Welcome to the deep dive. We've got some really interesting material you sent over this week, all focusing on mental health.
Yes, quite a deep topic.
Our goal here is really to pull out the key ideas from these sources, just to give you a good foundation on why this stuff matters so much for, well, just overall well-being.
And it's probably worth saying right off the bat, mental health and physical health,
Yeah.
they're not separate things. They're really, two sides of the same coin.
Yeah, absolutely. If you neglect one, the other suffers. Your mind deserves the same attention as your body.
Right.
Nice. Okay. And look, we won't list specific conditions today. There's a whole spectrum out there. It's complex.
Yeah.
But let's maybe jump into something major that lots of people run into. Stigma.
Yeah, stigma. It's quite striking, actually, how deep some negative stereotypes run.
Right.
Some of the studies you shared, for example, they really showed how that fear of being judged, it can make someone wait years before seeking help.
Years. Wow, that's a direct impact right there.
Definitely. A tangible consequence.
And that fear, that judgment, it ties into another really critical piece, doesn't it? Trauma.
It absolutely does.
Yeah.
Your sources laid out how traumatic experiences, well, they can leave these long-lasting marks,
Oh, so.
affecting everything, really, from how someone handles emotions day to day to, their relationships. It's not just the event itself.
It's the echo afterwards.
Exactly. How it kind of reshapes things internally over time.
Okay, so thinking about that, if we know someone, maybe a friend or family member who seems to be struggling, what can we actually do? How can we support them?
Well, the main thing, I think, is creating a space where they feel safe, where they won't be judged.
Just being there.
Yeah. Just listening, showing some empathy, and maybe gently, encouraging them to think about professional help.
Gently, right. Not pushing.
No, not pushing.
Yeah.
Just being a supportive presence, that can honestly make a huge difference.
But it's not all on us as individuals, is it? What about, say, schools
Oh.
or workplaces?
That's a great point. And the materials really highlighted the role these institutions play, or should play.
Like what specifically?
Things like having actual mental health awareness programs, providing real access to resources, maybe counseling, and just building a culture where it's okay to talk about this stuff, making it less taboo.
Okay, speaking of resources, therapy, counseling, people often use those terms interchangeably. Is there a simple way to think about the difference?
Yeah, they do get mixed up. Maybe think of it like this. Counseling often tackles more specific, like present-day issues, finding solutions.
Right, practical stuff maybe?
Kind of. Whereas therapy might go a bit deeper, looking into, say, underlying patterns, maybe past experiences, aiming for broader understanding and change.
So different tools for different needs, potentially.
Exactly. Both are really valuable ways to get support.
And why is catching these things early so important? You hear about early intervention a lot.
Because it can generally change the whole picture. Identifying and addressing challenges when they first pop up, it can often prevent things from getting much worse down the line. It promotes better long-term health. It's about, setting a more positive course early on.
Makes sense. Now, your sources also mentioned this isn't just a local issue, it's global.
Oh, absolutely.
Yeah.
Mental health challenges, they don't respect borders. It's a worldwide concern.
And countries are tackling it differently.
Yeah, in various ways. Things like public health campaigns, trying to improve access to care, big efforts to chip away at stigma on a societal level. It's happening everywhere in different forms.
Okay, last practical point, perhaps. Are there any sort of general warning signs, things we might notice that suggest someone, maybe even ourselves, could use some professional support?
Sure. It's usually about persistent changes. So, big shifts in mood that don't go away.
Okay.
Major changes in sleep patterns or appetite. Someone pulling back from activities they used to enjoy.
Withdrawing?
Yeah, withdrawal. Or maybe difficulty concentrating, being much more agitated than usual, or, importantly, any talk about self-harm. Those are definitely signals to take seriously.
Right. Important indicators. Okay, let's try and weave this together a bit. We've talked about stigma being this huge roadblock, how trauma can echo through time, the importance of support from people around us, but also from institutions.
And early intervention, catching things early. Plus, the global view.
It's all connected, isn't it?
It really is.
Yeah.
Like if you reduce stigma, maybe more people feel okay seeking help earlier.
Which could lessen the long-term impact of something like trauma?
Potentially, yes. It's all intertwined.
Okay, so wrapping up, here's something for you, the listener, to maybe mull over. Think about the messages you've absorbed, maybe without even realizing it, about mental health,
Yeah.
your own assumptions.
Yeah, those subtle biases we all carry.
Exactly. And maybe ask yourself, what's one small thing you could adjust in your thinking or even your actions to help create a slightly more supportive space for yourself and for the people in your life?
It really brings it back to individual awareness, doesn't it? And how that can ripple outwards to affect our communities. A powerful thought to end on.